Ever woken up, looked in the mirror, and thought, why do I look like a mango that missed its vacation? No, it's not your camera filter betraying you. That yellow glow might be your body waving a big fat warning flag. Jaundice. Welcome back to DocDecoded, the place where medical jargon goes to chill and health tips come with a side of humor. If your pee's looking like cola, your poop like chalk, and your skin like a highlighter, hang on, we've got some decoding to do. What is jaundice? Jaundice isn't a disease. It's a sign of something going on in your body. It makes your skin, eyes, and even body fluids turn yellow. Thanks to something called bilirubin, a yellow pigment that's a natural part of the body's waste system. Bilirubin is made when red blood cells break down. This is normal. Usually, your liver filters it out and gets rid of it through stool and urine. But when something messes up this process, bilirubin builds up in the blood and starts showing up in the places it shouldn't, like your skin, and your body starts to glow like it swallowed a flashlight. Thus, jaundice appears when blood bilirubin level increases as a result of imbalance between bilirubin production and clearance. Normally, your liver handles bilirubin like a pro, filters it, flushes it, forgets about it. So, what causes jaundice? Broadly, we divide it into 3 types based on where the problem is. Prehepatic, before the liver, means those causes where problem arises before that liver can filter. This happens when there's too much bilirubin being produced for the liver to handle. Conditions include infections like malaria, hemolytic anemia, or breakdown of red blood cells. Ineffective red blood cell formation, as in cobalamin, folate, and iron deficiencies, may cause jaundice. In absence of hemolysis, there can be a problem with liver uptake or conjugation of bilirubin. Certain medicines, like rifampin, probenecid, may increase bilirubin. Hepatic, inside the liver. Here, the liver itself is the problem. There is inflammation of liver called as hepatitis. Inflammation you can consider as the swelling of your liver caused by many factors, like infection, chemical or certain medications, herbal preparation, excessive alcohol, or end-stage liver disease or cirrhosis from any cause. Here, jaundice is associated with darkening of urine. This is due to excretion of a compound of bilirubin called conjugated bilirubin. You may have tea or cola-colored urine. A history of joint pain or generalized body pain preceding jaundice suggests hepatitis is either viral or drug-related. Your liver is like your phone's battery. Drain it too much, and eventually, even the charger in the form of medicine may not help. Post-hepatic, after the liver. This occurs when there's a blockage in the bile ducts. Could be due to dislodged gallstones, tumors, or pancreatic issues. Jaundice, associated with a sudden onset of severe right upper abdominal pain and shaking chills, suggests stone in the bile duct and inflammation. Here, patients may have itching and scratching all over the body, especially on abdomen and hands, along with jaundice. Think as the process is like, it's like a traffic jam, bilirubin ready to exit, but either the road's blocked, the driver's drunk, liver damage, or there's a pile up on the highway, excess breakdown. Before we dive deeper, hit that subscribe button and ring that bell, because we are launching a series where we break down each type of jaundice, like a detective solving a yellow-tinged mystery. The most obvious sign of jaundice is yellowing of the eyes and skin. But jaundice doesn't stop there. As the serum bilirubin levels rise, the skin will eventually become yellow in light-skinned patients, and even green if the process is long-standing. That green color is produced by oxidation of bilirubin to biliverdin. Depending on the cause, you might also experience dark-colored urine pail or clay-colored stool, fatigue, nausea or vomiting, abdominal pain, itchy skin. In newborns, jaundice is pretty common and usually harmless if appears within a few days. About 60% of full-term babies and 80% of preterm babies develop some jaundice in first week of life. Usually mild and temporary, known as physiological jaundice, however, exception exists. But in adults, It often signals an underlying issue that needs attention. Hey, mind it, if your pee starts looking like cola and your poop looks like chalk, your body is clearly going through some identity crisis that is appearing as jaundice. Quickly start your research work with your doctor, not in Google. So, how do doctors diagnose jaundice? Doctor calls your jaundice as icterus. Doctors will start with a physical examination and a discussion of your symptoms. Slight increase in the serum bilirubin level is best detected by examining the sclerae, that is the whitish part of your eyes. You know why sclerae got yellow during jaundice, even with mild bilirubin rise? Sclerae have a particular affinity for bilirubin due to their high elastin content, and presence of scleral icterus indicate a blood bilirubin level of at least 3 mg DL. The duration of jaundice and the presence of any accompanying signs and symptoms, such as arthralgia, myalgias, rash, weight loss, abdominal pain, fever, itching, changes in the urine and stool, give direction towards diagnosis. Then accordingly, they may recommend blood tests to check bilirubin levels. Doctors try to find out the cause by reviewing the level of direct and indirect bilirubin. Let's not go into the details. It will be too complicated for you to understand here. If you are still interested to know, please put a comment. We will have a separate video on it. Liver function tests, LFTs, and liver enzyme tests are done to understand how well the liver is working. Measurement of AST, ALT, ALP, GGT are helpful in differentiating between hepatic and post-hepatic causes. In addition to enzyme tests, all jaundiced patients should have additional blood tests, specifically albumin levels and prothrombin time to assess liver function. A low albumin level suggests a chronic process, such as cirrhosis or cancer. A normal albumin level is suggestive of a more acute process, such as viral hepatitis or stone. Infection markers. Ultrasound or CT scan to look for blockages or liver changes. Urine dipstick test, icto test to detect conjugated bilirubin fraction. Sometimes an MRI or biopsy if something more serious is suspected. It's like your body is throwing yellow flags and your doctor becomes a detective with a lab coat instead of a magnifying glass. Here's the thing, jaundice itself isn't treated, the underlying causes. If it's hepatitis, antiviral or supportive treatments are used. If it's due to gallstones or tumors, surgery might be needed. In long-standing cases, if medicine or supportive treatment is not working at all to improve, transplantation is the only option left in end-stage liver disease. Alcohol-related jaundice, step 1 is stop drinking. Your liver will thank you. In newborns, phototherapy, light therapy is often enough. And for some cases, like Gilbert's syndrome, no treatment is needed. It's harmless and comes and goes. Some treatments are high-tech, others are as old school as drink water, rest well, and stop partying like you're 21 forever. Let me tell you something to make you more cautious. Consider your liver as a lifeline. Once it is destroyed, only transplantation is the option. Therefore, do not ignore the symptom of jaundice. Go to a doctor and get diagnosed rather than sitting in the home and taking home remedies. This is dangerous and irreversible damage can occur within a short period. Can jaundice be prevented? In many cases, yes. Here's how. Limit alcohol and avoid binge drinking. Get vaccinated against hepatitis A and B. Protection from hepatitis. C. Practice safe food and water habits to avoid infections. Maintain a healthy weight to prevent fatty liver. Avoid unnecessary medications or herbal supplements that may harm your liver. If you notice yellowing of eyes or skin, dark urine, and pale stools, constant fatigue or abdominal pain, sudden weight loss, or if a newborn has jaundice beyond 2 weeks, see a doctor. Don't wait for your friends to say, you're glowing. It's not that kind of glow up. Let's know an interesting fact. You know, the skin may appear yellow even without having jaundice in certain conditions. Carotenoderma is associated with diabetes, low thyroid hormone, anorexia nervosa, and in fact, most commonly caused by ingestion of excessive amounts of vegetables and fruits, such as carrot, leafy vegetables, squash, peaches, oranges, that contains carotene. Certain medications like quinacrine, sunitinib, and sorafenib can also cause yellowish discoloration. In jaundice, yellow coloration of the skin is uniformly distributed over the body, whereas in carotenoderma, the pigment is concentrated on palms, soles, forehead, and near nose-mouth folds. In carotenoderma, there is no involvement of sclerae, completely opposite to jaundice. There is no reason to worry unless you have other associated symptoms of jaundice. Limiting the food and chemical causing yellow discoloration will resolve your problem of carotenoderma. So, to sum it up, jaundice is a symptom, not a disease. It's your body's way of saying, hey, something's not right in liverland. Don't ignore it. Data states that while extrahepatic biliary obstruction and drugs are common causes of new-onset jaundice in developed countries, infections remain the leading cause in developing countries. Which one is common in your place? If you learned something new today, give this video a thumbs up, share it with your yellow-eyed friends, and subscribe to DocDecoded for more medical topics decoded in everyday language. Stay healthy, stay bright. But not yellow bright, okay?